Good morning. This is Melissa Walker from the Iowa Department of Education. I'm the administrative consultant for health services, and I'm here with my partners from the Iowa Department of Public Health to discuss the coronavirus. So I'm just going to kick off a little bit and talk about some policies and collaboration techniques that schools can use to address their preparedness planning. In planning, schools have existing policies surrounding communicable disease and universal precautions. In the letter sent out to superintendents last week from the department, the Iowa Association of School Boards, in collaboration with the Department of Education, shared some sample policies to encourage for your school district or school to review. In the event of a potential school closure, there were some questions that might come about surrounding students who are receiving services through IDEA. In communication with our legal counsel, Thomas Mays at the department, he expressed that a closure would not require compensatory education, and a closure would be addressed through the schooling calendar day. So those are just a couple questions. I'm sure that there'll be more, but I'm hoping as this webinar goes on that we can answer some of them for you. On the collaboration piece, I would like to encourage schools to communicate with their Department of Public Health prior to any messaging related to coronavirus numbers, potential cases, or anybody that's being monitored. And if you haven't reached out already with your local public health department, there's a website link here that you can access so that you can find your person to contact in your area. That way you'll have somebody ahead of time before any kind of messaging. I'm going to go ahead and turn this over to Dr. Fedati.
Thank you so much. So I'm Dr. Caitlin Pedati, the State Epidemiologist and Public Health Medical Director for the Iowa Department of Public Health. And I want to thank you all for taking time to join us to talk about COVID-19. So just a little bit of introductory comments. We're going to have everybody muted throughout the presentation, but as we go along, please do feel free to ask questions, and you can do that by typing them into the question feature box on your control panel, and then we'll go ahead and go through the questions at the end of the presentation. We also want to let everybody know that we're going to be recording this session, and there'll be a link that will be made available afterwards for you to view, and that will come through a follow-up email. So we're going to talk today a little bit of background on COVID-19 and the epidemiology, the patterns that we're seeing, which have been changing over time. We'll talk to you about some of the traveler monitoring and healthcare screening that public health is doing. We'll talk to you about some of the COVID-19 specific guidance for you all as K through 12 school administrators. We'll talk a little bit about some communication resources, and then we'll have an opportunity for some Q&A. So starting with a little bit of background, when we talk about coronaviruses, we're actually talking about a full family of viruses. And they're named that way because some of the structures on the outside sort of resemble a crown, so they got this Latin-inspired name. So we knew that there's a group of viruses. Some of these can sometimes infect animals, some can sometimes infect people. There's a few that can affect both. We actually know that there's 7 of these coronaviruses that can infect humans, and 4 of those 7 are really common. They cause self-limiting mild to moderate upper respiratory illness, really similar to the common cold. And most of us have actually probably had one of these at some point in our lifetime. These are the kinds of coronaviruses, for example, that are currently able to be tested for on the tests that doctors would be running right now. Now, in addition to these 4, there's 3 other coronaviruses that are more severe and can cause more serious and even life-threatening illness. So these are going to be MERS, SARS, and now this new 2019 novel coronavirus, or COVID-19. And right now, COVID-19 testing is not something that's available just routinely at the doctor's office. It's really only available by working with state and federal public health. So a little bit more background on how this virus kind of came about. This was first identified last December in Wuhan in the Hubei province of China. And a lot of the first patients that we saw in this outbreak actually were associated with visiting a seafood and animal market. And so we thought that this probably represented initially some animal to person spread. Now, since then, we've seen that this virus is able to move from person to person, and it's done that in over 35 different jurisdictions. And we think that this happens when people are close to each other, so within 6 feet. And we think it's happening through droplets. And so that means when somebody who's sick with the virus coughs or sneezes, these sort of little liquid droplets can land in the mouth, nose, or eyes of somebody who's nearby. We think that people who are sick are really most contagious when they have the most symptoms. And it's possible that this kind of virus could be passed by touching a surface that would have the virus on it and then touching your eyes, mouth, or nose. But we don't think that this is the primary way that this virus spreads. And it's not a very hardy virus. It doesn't last very long on surfaces. So many of you have probably seen there are a couple of places publicly where you can look at some of the case counts that are being reported from the various departments of health or country level ministries of health. And what you're seeing now is the example of the dashboard that's provided through the World Health Organization that provides some of these counts. There's also a similar dashboard that's being maintained through Johns Hopkins University. And in general, what you'll see, unfortunately, we're now at over 89,000 cases and 3,000 reported deaths from various jurisdictions. It does actually appear as though some of the case counts in mainland China have slowed a bit. And what we're seeing now, unfortunately, are other jurisdictions that are reporting more cases. We wanted to also take a moment to sort of recognize that there's been a lot of information coming out about COVID-19 from a lot of places very quickly. And that can be sort of challenging because it can be hard to keep up with, and it can be hard to know sort of what the reliable sources are. And so we want to make sure that you all have access to up-to-date and accurate information, and that you know that you can reach that information by visiting the IDPH website. So we want to encourage you to do that, and we want to encourage you to refer people to that website as well. And as challenging as it can be when we've got information that moves quickly like this, I think it's also a reflection of the way that the public health and clinical communities are really working together very quickly to learn as much as we can as this goes along. And I would say that we've already seen some things have changed in the short period of time that we've been working on this. And it's possible that as we learn more, some of our approach to this may continue to change, which is why we wanted to take advantage of the opportunity to talk with you all today about the things that we can do today, things we might prepare for, and ways to stay informed. So you're seeing now some of the information that CDC is sharing on their website that's giving information about the cases associated with travel here in the United States that have been identified in travelers or communities. So at that point, that includes 43 cases and unfortunately 2 reported deaths. And then CDC is separately reporting, some other cases that are occurring. In the bottom chart, you can see in persons who were repatriated to the United States from high-risk areas, including Wuhan and the Diamond Princess cruise ship. So that group of people is being considered a little bit differently because they have a slightly different risk factor. CDC has also been keeping up to date, cases that are being evaluated and states that have reported cases. And they've been updating this every Monday, Wednesday, Friday. And for now, it appears that that's the pattern they're going to continue. But again, I would just say things may be adjusted if needed. Similarly, if you visit the Iowa Department of Public Health website, you'll find that we're also providing updates. We're providing updates every Monday, Wednesday, Friday on the number of people who are being monitored by public health, as well as the number of people who are being tested for COVID-19 here in Iowa. Another example of a piece of information that I think has been changing quickly would be, the information coming out around travel. And it's possible, in fact, it's likely that this information will probably continue to evolve, and we're going to continue to share that. And work with our federal partners to make sure that we're sharing, the most up-to-date information for you. What's important to note here is you can see CDC has issued a level 3 travel health notice, which is their highest level for both China and Iran, indicating that travelers should avoid non-essential travel here and that there may be restrictions on entry to the United States. Similarly, there are also level 3 notices in place for South Korea and Italy, which are demonstrating, again, travelers should avoid non-essential travel here. But the difference here is that there are no noted restrictions on entry to the United States right now. And then you'll see a level 2 notice for Japan, which is advising that older adults or those with chronic medical conditions consider postponing travel. And finally, you'll see a level 1 travel notice to Hong Kong. And again, I would just share that we know that it can be tough to keep up with how quickly this is evolving. And again, our goal is to make sure we're sharing all of this information as it's adjusted with you as quickly as possible. And it is possible that this will continue to be adjusted. So I wanted to turn over now to Dr. Garvey, who's going to talk to you a little bit about some of the monitoring and screening that public health has been working on.
Great, thanks, Dr. Fadati. Again, my name is Ann Garvey, and I'm the Deputy State Epi here at the Iowa Department of Public Health. And I want to take a few minutes and just describe to you what public health officials across the state are doing to monitor returning travelers from mainland China. So per the President's Task Force on Coronavirus, we are still screening travelers from mainland China because that is the area of the world where we're seeing the highest rate of illnesses being reported. There's no plan at this point to expand traveler screening to include travelers from additional affected areas like those shown on the previous slide as having warnings for travel, because the rates of illness in those areas are still significantly lower than the rates being reported in China. So as of right now, we're continuing to monitor travelers returning to the US from China. And the way that's happening is that flights from China are being funneled into 11 airports, those listed on the slide. Symptomatic travelers, so travelers who are sick, are being assessed by healthcare providers before they're allowed to be released. But travelers who are well and not having any symptoms are allowed to continue to their destinations. And then state health departments are notified of returning travelers, and we will assess a risk category to them based on the types of exposures that they had in the countries where they were visiting. So those persons that are assessed to be at high risk, so those would be people with direct contact with known cases, where we're concerned that they potentially would have been exposed to the virus, those individuals are being assigned a high level risk, but then also being issued a high risk voluntary home confinement order. And that requires that they stay home for 14 days after their last possible exposure, and they are also required to check in twice daily for 14 days with local public health officials to be assured that they're still fever-free and that they're not having any respiratory symptoms. Medium risk individuals, and these are people who may have been in mainland China, they are required to remain home for 14 days as well. They're also required to check in twice daily with public health officials. The only difference is these individuals are also allowed to take a walk outside as long as they're away from other people, or go for a jog, ride a bike, but they aren't allowed to go back to work or school. And low risk category would just be required to monitor themselves for symptoms twice daily for 14 days. There's no restrictions on their daily activities. So I'm going to transition and talk about what we're asking healthcare providers to do and how we're determining whether people should be tested for COVID-19 infection. So we're asking that healthcare providers screen patients as they either present for care or ideally when they're calling to make appointments. So the questions that we're wanting to be asked are, do you have a fever or respiratory symptoms? Did you travel from an affected geographic area? And we know that that's going to be a changing list of countries. Right now, it includes those listed on the slide. It's the countries where there were either level 3 or level 2 travel warnings in place. Or the third question is, did you have close contact with a lab confirmed case in the 14 days before you got sick? When a patient screens positive or answers yes to at least two of those questions, we're asking that healthcare providers do a more thorough assessment with the patient to confirm what signs and symptoms they may be having and get a little more information on where they traveled, when they traveled, and what types of exposures they had. Then we ask healthcare providers to call our department and we'll walk through a few other pieces of information to determine whether testing is appropriate or not. And you'll see on the slide just a breakdown of the individuals that would meet the testing criteria. So if someone had a fever or symptoms of lower respiratory illness, so cough, shortness of breath, and they had close contact with a laboratory confirmed case of COVID-19 in the 14 days before they got sick, we'd test them. If someone had fever and symptoms and required hospitalization and they had a history of travel to one of the affected areas within the 14 days before they got sick, we'd test them as well. And the final category is patients with a fever and severe lower respiratory illness, so pneumonia or acute respiratory distress requiring hospitalization. If we aren't able to determine an alternate diagnosis for these individuals, we would test them, and that would be even in the absence of a travel history. So this is how decisions are made on whether people will be tested. We're following this criteria really closely. So again, we just wanted to provide you some background information about the current state of the disease transmission, some details on the disease itself, and talk to you a little bit about what our public health and healthcare communities are doing. But now we want to transition to what we would recommend for schools. So the first thing I would say is that we do have school guidance posted on our website. At the end of the presentation, I'll show you how to get to it if you haven't seen it yet, but it should be pretty easy to find. So in the next few slides, we're just going to walk through that guidance. And again, if you have questions at any point, please enter those in the Q&A box and we'll answer those at the end of the presentation today. So before we have COVID-19 circulating in our communities, we're encouraging that all schools review and update their emergency plans in cooperation with local partners. And so Melissa had mentioned earlier in the presentation that she encouraged you all to reach out to your local health departments if you haven't already. We would encourage that as well. All of your community partners should be engaged in these discussions and understand what your plans say. So we really want those plans to be built on your everyday school policies and procedures. So we just want you to enhance the good things that you're already doing to cut down on illness transmission in your schools. So this would be including those common sense activities that you're already doing, emphasizing that sick students and staff need to stay home, recommending that coughs and sneezes be covered, cleaning the frequently touched surfaces, and routine cleaning is sufficient for coronavirus, for COVID-19, and really encouraging hand washing. That's incredibly important. Ideally with soap and water. If that's not available, then hand sanitizers with at least 60% alcohol can be used as well. We want to, again, encourage you to discuss your emergency plans with your local partners, specifically local public health and emergency management, and make sure that you all have measures in place to make sure that you're communicating regularly throughout this response effort. We'd also recommend that you monitor and plan for absenteeism. So review your usual absenteeism pattern so you know kind of what your baseline is in case you start to see an increase. We encourage you to continue to report greater than 10% absenteeism due to illness to the public health system, and that's either through your established channels with your local public health department or through entering the information on our website. I've included the link where you can enter those 10% absenteeism reports on the slide. And again, we really rely on these reports to help us understand how illnesses are impacting our school communities. And that's incredibly important right now as we're monitoring COVID-19 spread. So Again, review your attendance and sick leave policies. We want to really encourage students and staff to stay home when they're sick. That's really important. If you can use as much flexibility as possible to allow staff to stay home and care for their sick family members, that's important as well. We would discourage the use of perfect attendance awards and initiatives right now. Again, we really, really want to emphasize how important it is for sick kids and sick staff to be staying home. We'd encourage you to identify the critical job functions and positions that need to be filled in order to maintain school activity and plan for alternative coverage, and that could be by cross-training staff in case key staff members are ill and unable to come to work. And it's important that you understand what level of absenteeism will disrupt your continuity of teaching and learning. So we'd encourage you to kind of determine, or at least have an understanding of what level of absenteeism would be disruptive to your ability to continue teaching. We'd also encourage you to establish procedures for students and staff who become ill while they're at school. So we want those staff members and students to be sent home as quickly as possible. If there's going to be a time lag from when the students can be picked up or the staff can travel home, make sure that they are separated from staff and students to make sure that we're doing everything we can to prevent passing that illness on. One thing we want to emphasize is that we are not expecting schools to screen students or staff to identify COVID-19 cases. I included that screening guidance so you knew what was happening at the healthcare facility. That is not something that we are asking school nurses to take on. If kids are sick, if staff is sick, we'd encourage you to have them see their own healthcare practitioners. Again, we're not expecting school nurses to screen for COVID-19. And if a community or a school has cases of COVID-19, local public health officials are going to help identify individuals who may have been exposed and help follow up on next steps. So this isn't something that we're asking schools to manage on their own. We would also encourage you to share resources with the school community to help your families really understand what they need to do to keep their children sick, or keep their children well, and when to keep your children home. Again, I mentioned on a previous slide, routine environmental cleaning is sufficient for coronavirus, for COVID-19. We encourage you to routinely clean those frequently touched surfaces, including those areas listed on the slide. Again, this is the same activity you would do if you're seeing more norovirus, if you're seeing more influenza. Just keep doing what you're doing. Make sure that all the cleaning products, you're following the label instructions. Another suggestion is to provide disposable wipes so that those commonly used surfaces like the keyboards or remote controls can be wiped down by students and staff between each use. If you don't already, we highly recommend that you create a communications plan for your school community. So that would include strategies for sharing information with staff, students, and their families, including information about what steps are being taken by the school to prepare for and how additional information will be shared throughout the response. So those are all measures that we'd recommend you undertake now. And I'm sure that many of those procedures you already have in place. We just advise you to kind of take things out and walk through them if you haven't so far. At this point, I'm going to transition into what we would recommend for schools where there is identified COVID-19 activity within their communities. So we really want to emphasize that we're not asking schools to make decisions about whether they should dismiss school or cancel events on their own. We'd encourage you to seek guidance from our department and from your local health department to determine whether those actions are warranted. Large event cancellations and school dismissals might be recommended for up to 14 days or possibly longer if we're seeing high levels of COVID-19 circulate in the community or in the school. And the nature of these actions, so the scope and the duration, is going to be fluid, and it might change based on what we're seeing for cases and what level of activity is occurring. So during school dismissals, we'd really appreciate your help messaging to students to make sure that they aren't just going to the mall together, those types of things. We'll talk about that in future slides. One question that we've received in the past is, when schools are dismissed, can the teachers continue to work or staff continue to work if they're well while the students stay home? And the answer to that is yes. It's okay to keep those facilities open and allow teachers to develop and deliver lessons or materials that they could be sharing with students remotely and maintaining continuity of teaching or learning, and also allow other staff members to continue to provide services and help with response efforts, as long as we're making sure that those staff members are still well. If they're ill, they should leave immediately. And while they're in the school, they should be maintaining at least 6 feet separation between themselves and the other staff members. Now, if IDPH and a local public health officials recommend temporary school dismissal because there is indication of possible community spread, again, the scope and the duration of the dismissal, that decision is going to be made on a case-by-case basis, and it's going to be based on the level of activity in the community and in the school system. And schools really need to make sure that they're working with their public health partners to ensure consistent messaging about the nature of the exposure and maintain confidentiality for any ill students and staff. It's important to make sure that we're maintaining confidentiality as required by ADA and the Family Education Rights and Privacy Act, and that's all information that Melissa is much more familiar with and can serve as a good resource for you if you have questions. If a student or staff member notifies school officials that they've been diagnosed with COVID-19 infection, school administrators should seek guidance from public health to determine when they can return to school and what additional steps are needed for the school community. There also may be questions that arise related to students and staff who are well, but they're taking care of sick people at home. And we can help provide some guidance on when those individuals should return to school and whether there's any additional measures that need to be taken. So if schools are dismissed, you should also consider temporarily canceling extracurricular activities and large events. So that would include all assemblies and pep rallies and field trips and sporting events. And again, we really, really would ask for your help in trying to convey to families that students shouldn't be gathering or socializing anywhere. We don't want them to all meet up at a friend's house or a favorite restaurant or a shopping mall, for example. And we know that that's out of your control as well, but any help that you can give us on trying to message that so that parents understand the importance of keeping that separation to cut down on illness transmission would be greatly appreciated. And again, we would suggest that schools ensure continuity of education if you can. So if you can implement e-learning or digital or distance learning options, that's great if it's feasible for your school. A couple of additional recommendations. We would recommend that you try to ensure continuity of the meal programs. If you have additional questions on this, you can reach out to the Department of Education. They may be able to provide additional assistance or clarify some of those program options. But consider ways to distribute food to those students that are so dependent on having those healthy meals, and potentially consider a grab-and-go bagged lunch or meal delivery option for those families that need that assistance, and consider alternatives for providing essential medical and social services for students. Again, the Department of Education would be a great resource for some of those questions that might come up in those areas. So when you see our guidance, you'll notice that we also included a couple of a draft press release and a draft communication letter that you could use with students. And again, we wouldn't want you to make the decision to cancel schools in a vacuum. We really, and we being public health at the state and local level, want to be part of those decisions. We want to be giving you timely and accurate information to help make those decisions. So please engage us in all of those. We just include these drafts so that you can include them in your emergency plans, but again, would not expect you to pick this up and do this on your own. So there's a draft press release, and there's also a draft letter that could be used as an email or however you wanted to communicate with parents about school closures. So at this point, I'm going to turn the discussion over to Polly Carver-Kim, who's our communications director for the department, and she's going to share some information and resources with you.
Thank you, Dr. Garvey. First of all, I want to thank you for joining us this afternoon, and also thank all of your communications professionals who I know are probably getting a lot of questions from parents and staff and probably the media as well. I'm sure they don't need any tutoring on how to work with the media, but very quickly, I'll just go over a couple of the things we really stress here at the department, and one of them is to try to be prompt to media responses. To avoid speculation, we know that that is a temptation because this is such a changing and rapidly evolving situation, but we try to just focus on what we know right now. We know that people are uncertain and anxious, so it's okay to acknowledge that. And we really stress that we want you to be transparent because, of course, you want to give all the information you can, but to always put confidentiality first. And if you have a question about any release or information that you want to pass on to your school district, go ahead and give us a shout, and we'd be happy to review it or work with you to figure out the best kind of messaging for the situation. For your information, Dr. Garvey stated earlier that we are updating numbers of testing, test results, people being monitored on our website, and she'll give you kind of a tutorial on how to find that in a couple of minutes here. We do that every Monday, Wednesday, and Friday. We just posted the new numbers for today before this webinar began. And we are not identifying individuals being monitored or tested at any lower level than statewide. There's no public health benefit to doing so, and in fact it can raise a lot of concern that's unwarranted, and also sometimes, especially in the school atmosphere, can contribute to teasing or lots of questions or rumors that may circulate if they find out someone in their community has been tested. I'd really encourage you to follow us on social media. You'll see our handles there for Twitter and Facebook. Those are the primary media platforms that we use to get out information about COVID-19. We also have a lot of the resources posted for you on our webpage, infographics that you can use. I don't know if you get the trolls on your web pages like we do on our social media, but they're there, and we try not to engage them or fight with them or try to change their mind, because that usually doesn't work. We do try to correct misinformation, though, whenever we can without trying to get into an argument. That's just a few of the resources that we have, and there's more to come on the web page. And I hope you'll keep this contact information happy. I'm happy that you would keep that contact information close. And please feel free to reach out to me at any time if you have any questions about communication or any messaging that you're doing, or if you want us to review something that you're proposing to send out to your school district or your parents, we'd be happy to take a look at that for you. Thank you.
Great, thanks, Polly. So at this point, we're going to transition and start answering some of your questions. One thing I do want to highlight, this is discussed in the guidance, but we're seeing this topic kind of come up on the Q&A already. Currently, the CDC is recommending against, so they're advising that schools do not take any international trips at this time, and if there are students who are abroad, they're recommending that those students be brought home. Now, I'm assuming that you're all going to have a lot of questions about spring break trips, band trips to New York, or going to different jurisdictions. And I think that what's difficult about that is that this is a really rapidly evolving situation. And so while one jurisdiction may not be having cases today, they may identify 6 cases tomorrow. And I think that's going to be the nature of the response that we're going to be in for quite a while. So while we don't have guidance for individual locations per se, we can definitely let you know what we're seeing in these different jurisdictions on a day-to-day basis, but just know that's very fluid. And so I think it's going to be a tough decision for you as school facilitators or school administrators to decide whether you want to continue trips. We would obviously discourage you from taking trips to areas that are seeing active spread of COVID-19 across the U.S. Again, international trips are just, the recommendation is don't do it, but we're talking in the U.S. If we're seeing locations, for example, in Washington, we discourage you from taking trips to areas that are having ongoing activity. So before we get into the questions, let me just take a quick detour, and I'm going to go through, show you how to get to our resources on the website. So bear with me a second here. Okay, so you should just see my Google browser. Our website is www.idph.iowa.gov. Once you get to our main page, you'll see COVID-19 in the banner. Click on that, and that takes you to our COVID-19 resources. So you'll see the numbers of people being monitored and tested on our website here. And then if you scroll down, we have guidance for different types of partners. Schools is the second one listed there. The first link takes you to the recommendations that I walk through in the slides. And at the end of this document are those draft communication pieces that, again, we'd want to be coordinating with you before we make any decision to close, but want to make sure that you have those resources should we need to use them. The other things that are listed here are talking points for schools. Those were distributed last week. Those talking points, I think, are still really relevant, so we'd encourage you to continue to use those as you communicate with your families. And we have a fact sheet about talking to children about COVID-19 that might be helpful, especially for your elementary students. So those are the school resources that we have posted on the website. I would encourage you, if you have additional resource needs that aren't covered in these resources, just reach out to us. We want to support you the best we can. At this point, we'll transition to taking questions. Can we post a link to the presentation here? So what we will do is all registered participants will be getting an email from us that have a link to the archived webinar from today. We'll also include our slides so that you can use those for communication. If you want to use those for staff discussions or whatever, you'll have those as well. The next question is, our choir is traveling to New York on March 14th through 18th. I see there's a new case in New York today. What advice do you have for us?
Yeah, again, I think to reiterate what Dr. Garvey said, we know this is hard because things have changed and they might continue to change. Right now, I don't think that there's enough of a risk that we would advise that you cancel that trip, but I think that that could change, right? So if there were to be sustained community spread of COVID-19 in a particular place, even in the US, our recommendation would be to avoid a trip to that location. Now, again, I don't think that's describing New York yet. I know that things can change and that it's hard to make some of these plans when we don't sort of know exactly how things will happen. But I would say the recommendation to avoid travel is based on whether we're seeing widespread community activity in a particular location.
Next question is, what about connecting flights? So again, I just want to clarify, we are only receiving notification of travelers returning to the U.S. from mainland China. We're not receiving notification of travelers returning from Thailand, for example, or Korea or Italy. Those notifications are not occurring. And so for the people returning from mainland China, those flight manifests, they being the federal government, they are looking back to where the flights are departing. And so even if you transition through another airport, if your original point of departure was in mainland China, we should be receiving your information to monitor you. So regardless of where you connected, if you left from mainland China, we should be receiving all of those travelers. Is there a tool created by IDPH to help schools create their plan? We don't necessarily have draft plan templates, but I would share with you, I'm going to pull up this guidance document. You should still be seeing this. Yeah. At the end of this guidance document, there are several resources listed there under planning and communication resources, where federal agencies do have some planning guidance templates and things that I think would help you get a start on developing your school emergency plans. What constitutes routine cleaning of surfaces for COVID-19 in schools? And again, we would recommend that you continue doing what you're doing, paying a special attention to
High touch surfaces.
Thanks. Go ahead, Dr. Budati.
Yeah, the high touch surfaces, right? Your doorknobs, railings, things like that. And when we say routine, what we're trying to describe is that, any cleaner that's EPA approved for a particular surface, to clean to clean viruses, would be an appropriate thing to use. So you want to look at the surface that you're cleaning and make sure that you're reading the label on the cleaning product that you're using and that it's appropriate for that reason. And there's also additional environmental cleaning guidance that we can probably link to through CDC.
Okay, great. We have a couple of similar questions. So we'll click through those. Anything on that one? Question about how long does COVID-19 live on surfaces?
Yeah, we don't think that coronaviruses are particularly hardy or strong viruses. So they don't seem to live for very long, but it's possible that they could live for a short period of time, particularly if the surface is wet, with snot or something like that. So, cleaning, hand washing, and people, keeping people away who are sick are all important ways to reduce that. But we don't think that the virus lives very long on surfaces.
Okay.
There's a question about monitoring for fever. Is it associated with low grade or higher? It's a range. And so, fever in general, I wish I could give you something more specific, but there appears to be a range. So just fever in general is the recommendation.
So we have some questions about how Iowa code dictates what can be counted as a school day in regard to remote delivery of instruction. And Melissa's going to take that back to the Department of Education and get some additional guidance out to you. We have a question about whether school trips should be allowed out of country during spring break. For example, a mission trip to the Dominican Republic. And at this point, CDC is recommending that that schools not travel internationally. So that would be our recommendation as well. Logistics question about someone missed the start of the webinar. Is it available to rewatch? Yes. So again, everyone who's registered for this webinar will receive a link to the archive version of this webinar so that they can go back and view parts they missed, or they can share it with others that weren't able to join. And also, we'll send you these slides.
There's a question about what are the distinguishing symptoms to identify COVID-19. It's a great question, and unfortunately, there aren't necessarily distinguishing symptoms. So, you know, the symptoms people have, fever and cough or trouble breathing, are precisely the kinds of symptoms that we know can cause a variety or be associated with a variety of seasonal respiratory illnesses, which is part of why the general advice to people to cover your cough, wash your hands, and stay home when you're sick with any illness are going to be really important for this.
We have a question. Back in 2005 through 2007, we developed a pandemic policy. Is that considered our emergency plan? And yes, that would be the plan that we'd encourage you to pull out. You may need to make some modifications to it for coronavirus, but certainly that's going to be a great starting point, and should be something you're reviewing. Question, just to clarify, did you say CDC is recommending no school international trips at this time?
Yeah, so the CDC just very recently posted guidance for schools, and the advice is that schools should consider postponing or canceling any abroad trips and consider bringing home people who are associated with abroad programs. So again, we know that that's a hard thing to do. It's not something we take lightly. I think, you know, just recognizing that as we've seen cases expand to other countries, to minimize risk, the recommendation would be to avoid international travel.
Okay. There's a question related to, would that include foreign exchange students? And we're going to have to get some clarification on that.
Yeah, maybe we can follow up with that person afterwards if you're saying, you know, I'm not sure if I understand which travel specification you're asking. We can follow up with you.
Oh, excuse me. So if you have students who are studying internationally, we would recommend that you potentially bring them home, but let's get some more, we'll get some more detail on that. Question about, do we have a current letter to families that schools can share right now? Go ahead, Polly.
Yes, actually, it was drafted and is just getting in the final review right now. We'll get that finished and probably can send that out with the link to this webinar.
Great. We'll get that posted on the website as well.
So there's a question about trips, you know, for example, to other locations like Washington, D.C. Again, you know, the advice to avoid or adjust travel plans, we're basing that off of places that we've seen have, you know, widespread community level circulation of the virus. And we know that even in the past several hours, that information has been changing. It's probably going to continue to change. So, you know, what I would say right now is if you have questions about, you know, locations, you know, you can visit the CDC website. You can also reach out to public health to help you understand if it's a location that's having community level spread. And I know this is hard, but we have to acknowledge that it's been changing pretty quickly and it could continue to change. There's a question about suggestions on separating sick and well students I think the school nurse's office is what we're asking. You know, I think certainly anytime we identify somebody who's ill, you know, evaluating them so that they're getting the clinical care that they need, but, you know, also making sure that we're making advice that people either, call ahead to a provider or seek care as needed, but that we remove, people who are sick, or advise that people who are sick go home or stay home. That's going to be important. So, the more you can do to try to encourage people who are ill to not come to school, and as soon as we identify somebody who is ill, to get them sent home or to appropriate clinical care would be the advice. There's a question about healthcare professionals should be wearing masks. Should school nurses be wearing masks since you're in contact with sick kids? There's no current advice that school nurses or the general public need to be wearing masks, routinely. The advice for wearing masks is related to healthcare providers who are evaluating, potential cases, or providers who are taking care of known cases. Now again, I would just say, sometimes things can change. They may continue to change, but right now there's no recommendation that school nurses would need to wear masks. But just like everybody else, it's important for school nurses to do things like washing their hands and staying home if they're sick.
There's a request for multilingual documents. That's a great request. We don't have many translated documents on our site, but CDC does have more. So we'd encourage you to look towards CDC for some of those translated documents. There's a question about the website indicates there are 13 people being monitored in Iowa. Can we give locations as they're looking at school, travel, athletics, trips? We are not providing information on where persons are being monitored at. Again, we are monitoring people returning from mainland China. There are other individuals who are coming back from other areas of the world where there is some activity, and we are just encouraging that all healthcare providers do this screening, and we aren't able to assess risk at higher levels based on where people are being monitored. So no, we aren't distributing that information. The media is hyping this virus up, or is the media hyping the virus up, or is the virus something quite serious? Influenza versus COVID-19. They're looking for a comparison there.
Yeah, anytime there's a new virus that can infect people and make people sick, that is a very serious thing. And I think it's great to keep in mind some perspective, because we do want people to have perspective here, right? Even though it's serious, this is exactly the kind of thing that public health and others work to prepare for. And right now, even though there's continuing to be cases identified, the risk here in Iowa is still low. And so this is the opportunity for us to have conversations about ways to prevent the spread of viruses like COVID-19. And I know that it sounds simple, but those measures of washing your hands, covering your cough, and staying home from school and work when you're sick are really important things to do, whether we're talking about flu or COVID-19. So, I think that my general answer here is, it's important to keep this in perspective and to recognize that we have tools in place to help protect us from the spread of a variety of viruses, including COVID-19. And we want to make sure that people understand where to get accurate information and how they can protect themselves, which again includes covering your cough, washing your hands, and staying home when you're sick.
We have a comment that we have a school trip going to Italy in June. Is it possible that things will improve enough by then for this trip to continue? Really, we don't have any kind of prediction on how this is going to evolve from the standpoint of how quickly activity may slow in other areas of the world. So no, we don't have any kind of crystal ball to help forecast that. Are airlines sanitizing and disinfecting planes after trips? There is guidance. If you're interested, you could take a look at it. That CDC is shared with airlines on disinfection and keeping their staff safe. That is posted on the CDC website.
There's a question specifically asking for travelers returning from Micronesia and wondering about, testing and tracking. I think you're making a good point about there's probably a variety of levels of ability for testing and tracking in different countries. There are no sort of current CDC travel health notices that I'm aware of related to Micronesia. I think, again, it's important to recognize things could change. And I also think it's important to recognize, because there may be variations in testing and screening abilities, that's why it's so important to follow the guidance of really keeping people home when they're sick, and encouraging flexible work policies and good hand hygiene.
Again, a lot of questions about international school trips. And again, the CDC guidance recommends that schools consider postponing or canceling international school trips at this time. High school trips coming up, again, evolving situation, so we'd recommend that you continue to monitor the CDC website for information on where this virus is circulating. A good question, if local doctors and hospitals are not testing for COVID-19, how will people in our community be diagnosed if it's spreading within the US versus through international travel?
Yeah, you raise a very good question. And, with anything new, we kind of take a certain approach to how we find cases, and that can evolve over time. And you're right, you're recognizing that if we focus on travel and if we focus on severe cases, it's possible that there could be mild cases that would be harder to detect. And so, to that end, we are working on plans and ways to kind of understand whether there could be, more mild cases circulating. But at a certain point, if we do truly have mild illness circulating in the community, now certainly, I would prefer that everybody always be healthy. But if we did have that happen, that's exactly when it would be valuable to remind everybody of those basic measures of covering your cough, washing your hands, and staying home when you're sick with a mild illness, because whether it's a mild illness due to flu or COVID-19 or another type of virus, taking those measures is what's going to be the effective way to keep it from spreading.
Again, questions about Washington, D.C. To clarify, do we recommend canceling? At this point, Washington, D.C. hasn't had any kind of significant community spread, so that's not an area of the country right now that has identified COVID-19 activity. But again, that could change on a daily basis. We don't recommend that schools have masks on hand. The question was, do we recommend that schools have masks on hand to be proactive? And mask use is not being recommended for the general public, so that's not something we would recommend that schools stockpile.
And really, again, I know it's repetitive, but if you think about it, by the time you're putting a mask on somebody, they've probably already had symptoms, and maybe they've touched things. And that's why we want to be on sort of the early side of doing things like encouraging people who don't feel well to stay home, and making sure that people know how to wash their hands with soap and water or use Purell. I know that's hard with kids, but that's why we give that advice, because you really want to be implementing those kinds of measures to be preventing things from moving, through a group.
So we have a question on where do we find the latest data on COVID-19 information on activity throughout the U.S. to help decide whether students should travel to various locations. And so I'm taking it out of the CDC website. If you just click on coronavirus, you'll see case under situation updates right in the middle. You'll see cases in the U.S. And that gives you information on where the cases have been identified. And there's always additional information put out through CDC. If you have specific questions, we'd recommend you reach out to your local health department or to IDPH, and we can give you the information we have at that time.
There's a question about, Clorox wipes for routine cleaning. Yeah, again, just making sure that you're using it on the right kind of approved surface and for the right amount of contact time and following the directions on containers. But yes, that's an example of an appropriate cleaning tool.
A request for updated talking points. Polly's going to work on those and we'll get those updated as well. There's a question about desks for students. Would it be feasible to wipe down desks between each class, similar to the way wipes are used in shopping carts? And I think that's an interesting idea. If there's a way to make that work in your structure, that I think that's great. That's only going to cut down on potential illness transmission. So if you can make that work, that's a good suggestion.
There's a question about the definition of a fever. Generally, I think of a fever as 38 degrees Celsius or higher, but there have been other measures that have used just 100 degrees Fahrenheit or higher. Really, a fever either taken, by a thermometer or subjective would be something that we would want to take seriously. There's a question about what defines an outbreak. In general, when we talk about the definition of an outbreak, we're really talking about a group of illnesses, together in time and space that are above what we would expect to see for a normal baseline. And so outbreak can really vary depending on where you are and what time of year it is and what illness you're talking about. But really, we're talking about, a group of illnesses that's in excess of what we would usually expect.
There's a question about, are parents and employees required to let the school know if their children have been diagnosed with COVID-19? And we are working towards making the public health system will know where those COVID-19 cases are, and if there's concerns about your community or your school specifically, your local public health partners will be reaching out to you.
There's a question about if there are students outside of the country, do we need to do anything special when they return? It depends, I think, on where outside of the country they are. So if you have individual students who are outside of the country and they're in a place where there's community level, spread of this virus, we're probably going to want to talk to you about encouraging them to monitor themselves, for a 14-day period. But we'll be sharing additional guidance on that soon. But outside of that, if it's not a location that's specific to where this virus is circulating, no, there wouldn't be anything specific other than just the general things we would tell anybody who's traveled and returning. And again, it's important to recognize there are many viruses that are circulating at this time of year, including flu, that can make people sick. And we always want to encourage people to stay home if they're sick. There's a question about what states are experiencing widespread COVID exposure at this time. There's not a single state here in the United States that is considered to be experiencing widespread COVID-19 activity. There are several states that have detected cases that don't have a known travel link. And so those are places where we are starting to wonder about community level activity. And again, I know this is hard. That's going to continue to change over the coming days. And referring to that CDC webpage that Dr. Garvey highlighted, as well as referring to the IDPH webpage, will be good places to look for information. There's a question about, will there be a statement from IDPH regarding travel? It appears that there's a lot of questions. A standard statement would be helpful. Yeah, you'll likely be seeing some messaging from us around that here shortly. There's a question, are deaths related to complications from the virus or the virus itself? Thankfully, we've only had 2 deaths here in the United States. I think this is an example of a place that we're still learning more about this virus, but we know that viruses like COVID-19 can cause respiratory breathing, problems, and that's one way that they can cause problems, including being associated with death. And there are other times where people might have other ongoing conditions or bacterial infections on top of a viral illness that could cause problems for them. So, I think right now I would say that it remains to be seen, but this virus does seem to be, these kinds of viruses seem to be capable of causing serious respiratory or breathing problems that can lead to death. What is the rate of transmission or death for COVID-19 compared to flu? Again, I think everything, and I know this is hard, it's important to realize we're still learning more about this virus. We have sort of a limited amount of information, but I can tell you what we've learned so far from some of the experience in China would be that the mortality rate for COVID-19 might be around 2% in sort of the epicenter of where it was identified, and 0.7% in the rest of mainland China. And that would compare to a fatality rate of about 0.1% for influenza. But I would also say that, again, we're still learning more about this virus, and that could change.
Couple of questions about treatment.
There's a question wondering about if somebody's positive, what is the treatment? There's no current therapeutics available or vaccine available for COVID-19. Those may become available eventually, but that would be after many months to maybe over a year. So right now the treatment is really just supportive care. And again, there's a range of illness with this virus. Some people are only very mildly ill, which we know other coronaviruses can do. And so that's why some people would be appropriate for just staying at home and taking care of themselves. There's a question for, do schools need N95 masks? No, schools do not need N95 masks. There's a question about, do rural clinics have testing available? No, right now the testing for COVID-19 is being done at the State Hygienic Laboratory. It's possible that eventually there will be commercially available tests. And then at that time, different providers might choose to order those depending on, what's feasible. But right now, testing is only being done in coordination with our state laboratory.
If we did have a patient that presented to a rural medical clinic and met the testing criteria, we would test that individual. So that testing is available to Iowans statewide as long as they meet that testing criteria. How are they identifying positive case? So I think you're saying, how do we release that information? And we would put that up on our website. We would also be messaging that through a lot of different venues. And so if we had a positive case in Iowa, that would be something that we would be talking to the media about and officials in the area as we determine whether there's additional risk.
There's a question about are elderly infants immunocompromised at higher risk or relatively healthy people passing away? We do seem to think, based on the early United States experience, that this seems to be more of a problem for people who are older, who have chronic conditions. And so I think, your line of thinking here is right, that anybody who has a problem, with an immune system that can't fight things as efficiently, those are probably higher risk people. We have seen in China and other places that there have been some younger people who have passed away. So, it's not clear, whether there was something else going on with them, either, chronic health conditions or behavioral health issues. But I think, in general, we're thinking that this will likely impact that population more, but we still have more to sort of learn here. There's a question about additional steps to minimize transmission, like air purifiers. There's no current recommendation for specific air purifiers or specific antimicrobial sprays. Those are good questions, but again, we just want to reiterate, and we know this can be a lot, we know this can be overwhelming. We have good tried and true mechanisms in place for protecting ourselves against viruses. And I know it sounds basic, but covering your cough, washing your hands, and staying home when you're sick are really important things to do. There's a question about schools send students to clinics or doctor's offices for exams or to participate in activities. Is there guidance to doctor's offices to minimize exposure to those who are sick? Yes, we've been in contact, with our clinical partners at a variety of levels and in a variety of roles to provide them with similar guidance. And there's also good infection control guidance that we use and recommend, again, regardless of what virus we're talking about.
There's a comment that our district had a sick bay years ago where 6 students could go during the day if their parents didn't have daycare. Is this a feasible plan, or would this just be a hotbed for transmission?
I appreciate the idea here, and I'm glad that somebody is thinking through sort of the processes of what does it look like if somebody is sick. I think the preference is really when somebody is sick with anything to keep them, at home and away from others, having somebody in an environment where they can be exposed to other kids, other staff. Anytime you increase the chance of another interaction, you increase the chance that the virus can make somebody else sick. And so the preference would really be to keep people at home and away from others. There's a question about should schools be ordering no-touch thermometers. There's no need to order any particular type of thermometer.
There's a question at a minimum, what should schools be doing to prepare for the possibility of an outbreak locally? We'd really encourage you to take a look at the guidance document that's posted on our website. It's got some good considerations for schools to really work through in preparation for the potential of COVID-19. So again, take a look at those guidance documents, and it outlines those recommendations.
There's a question about schools consider the threshold for somebody to go home a fever. So if you have a cough or other symptoms, are you safe to be at school? This is a really good question. I think certainly anybody who is saying, reporting a fever or has a measured fever, those are people we'd want to send home. And I think people who have any sort of illness or symptom, any unexplained type of symptom, we want to make sure that we're being as flexible as we can to allow whether you're staff or whether you're student, if you're saying you're not feeling well, if you're feeling sick, that we're flexible in allowing you to go home.
A couple of questions about testing. Again, currently the testing is available at the State Hygienic Lab. That has a turnaround time of about 24 hours. The test itself takes about 4 hours, but as you know, it sometimes takes a while to get transported across the state. So again, 24 hours is our goal with turnaround time. There's some questions about whether there's rapid testing capabilities for clinics and hospitals. At this point, the answer is no, but there are tests in development, and so that may change in coming weeks.
There's a person who said they put out a short article to staff comparing coronavirus to flu to get them less hyped up. Was this okay? Yeah, I think that's great. And again, I think there are many things that flu and coronavirus have in common, and there are some places where they differ. But something that's important to keep in mind is the same type of messages that you hear the Iowa Department of Public Health share every September around flu are the same messages that we're sharing now. And again, we want you to understand that we take this sort of thing seriously. We want to prepare for this sort of thing, but there are things you can do, and helping people understand some of the similarities and the ways to protect yourself, like covering your cough, washing your hands, and staying home. Those are good, and those are appropriate things to do. There's a question about applying masks to an ill student. Again, we're not trying to ask, our schools or school nurses to be, healthcare proxies, and there's always going to be a balance between providing the level of clinical care that an individual needs and making sure that we're maintaining, public health safety. There's no need to maintain, a stockpile of masks or to put masks on students. We want to make sure that we're just encouraging everybody on the front end to, keep people home when they're sick, and stay out of school and work when they're not feeling well.
There's a question about a school has pregnant employees. Are there extra precautions that should be taken with them? Again, it's the same precautions that we'd recommend for all students and staff. making sure we're staying home if we're sick, washing hands, covering coughs and sneezes. So nothing in addition for those pregnant employees.
There's a question about wearing a mask to clean if I think if the virus were found in your area. Again, there's no recommendation that anybody needs to be wearing masks. And again, I totally understand, asking the question, but really where we want people to be is on the preventive side, and staying home when you're sick and washing your hands and all of that. There's a question about students using disinfecting wipes without wearing gloves or getting things in their eyes. I think it depends on what you mean by disinfecting wipes. And again, I just would make sure that when people, are using, any kind of cleaning agent, you're just following the directions for the surfaces and appropriate safe uses. There are some wipes that are okay for people to touch, and there are some wipes that are really should be used more for cleaning surfaces. So just following the directions on those containers is going to be what you want to do.
Yeah, and some confusion about testing. There is testing in the U.S. There's testing at CDC currently. There's testing at state health departments, many state health departments, including here in Iowa. Our state health department can do the testing. So that is ongoing. I think the confusion was when we were referencing some of the other outside laboratories that are just developing that capability.
There's a question about at what point will the virus reach epidemic pandemic status? Epidemic is sort of another word to describe an excess of illnesses occurring in a particular area. So I think in certain places it's reasonable to say, certain countries are experiencing an epidemic. Pandemic really refers to a couple of things. It refers to a new virus, it refers to a virus that can move between persons, and it refers to a virus that is now moving between persons, reliably throughout communities all across the world. So it's that last piece that we haven't yet seen, but it is possible that, we could end up seeing that.
Person saying they don't recall registering for the webinar, they just clicked on the link. If you got the link, you should have registered. That's how you get the link. So you should be on the email distribution list, but certainly if you have any questions or concerns and think you're not getting it, reach out to your local health department.
There's a question specifically about students returning from Italy. We'll be providing some more guidance for you on that here shortly. There's a question about, is it true that areas of China have experienced widespread closures of schools and businesses? Is there any reason why we would not expect the same thing? Yes, that's true. Decisions were made in China to close schools and businesses, and implement some restrictions. Those are, I realize those sound, very serious. They are serious. Those are movement restrictions or ways that we limit person-to-person interaction to limit the spread of a virus. And that's why we make recommendations like staying home when you're sick, because the more you limit person-to-person interaction, the less of a chance there is for any virus to go from one person to the next. And so, right now there's no plans to sort of make those kinds of recommendations, but I would say that, again, if things were to evolve or worsen, we may be making suggestions about whether to cancel events and that sorts of thing. There's a question about, is there a thought that those who vape are more likely to experience severe disease? It's an interesting question. There are some thoughts that perhaps it's the high smoking rates in China that could contribute to some of the, severity that they've seen. I don't know whether that's true or not. I think, again, it's an example of a time that, we have more to learn. But in general, I think you're hitting on an important point, which is we should do everything we possibly can to maximize our health in general. And that includes staying up to date with our physicals and, staying up to date on our immunizations to keep ourselves healthy from other things. There's a question about status of vaccine. There is, efforts being made at NIH and with other agencies to develop a vaccine. It would likely be many months, if not over a year to years, before a vaccine would become widely available. There's questions on recommendations on handshaking. Again, right now, I think it's fine to do, but, making sure that people are washing their hands and, not handshaking if we're sick, and again, you're right to recognize that handshaking is another opportunity to transfer germs, right? And so, when we limit those things, we limit chances to transfer germs, and so that's something to keep in mind. And again, staying away from others when you're sick, avoiding sick people, and washing your hands are important. Where are we? If symptoms are similar to a common cold in some people, I'm sorry, I didn't see the rest of that.
Should kids with a severe cold be excluded from school? In the
Again,
absence of a fever.
I think, thinking about, if somebody is sick, if they're having symptoms, if they're feeling unwell, we just want to be flexible like we always do, right? And allowing staff and students who don't feel well to stay home. That's a reasonable thing to do. There's a question to clarify, they are not testing locally for the virus. If someone had it, they would be asked to stay home, but would continue to be contagious for 14 days even without a fever. So, testing, again, and I know, I apologize, this might be a little confusing. Testing is available. It's being done by talking with us at IDPH, and we work with our state lab that's performing the testing right now. So, anybody in Iowa who has a concern, we'd work with you and if it was needed, we'd work with you to get testing done. So that's how we would achieve that. In terms of, how long you'd be contagious and that sort of thing, we are using 14 days as a rough time period. But again, if we were to identify a case, we'd be working with somebody on a case-by-case basis to come up with what's safe.
Kids on chemo, do we have any special recommendations for those immune suppressed children? We really don't, other than it's just really important for those kids to be washing their hands frequently, staying home when they're sick, that type of thing. But there's nothing in addition that we're recommending for them at this time.
I think we covered that. Okay. We're gonna have to. Yeah, is it 60?
60.
There's a question about recommending a minimum percentage alcohol and hand sanitizers. That would be 60%.
We're down to our last 5 minutes. We've got through most of the Q&A. We're going to switch over to the chat box. Let me get to the top of it. So clearly we have two areas where we've got a lot of questions. One related to foreign exchange students. We'll get some additional information back to you on that. Another wanting some type of policy statement from us on travel. We'll work towards that. And the third area would be just some of the parameters around distance learning or e-learning if school would need to be dismissed. So those are the three areas that we're going to provide some additional guidance on in the coming days. A lot of the things in the chat box are duplicates. I'm just scanning through that quickly. Is it anticipated that as weather warms up and people are outdoors more, that this will help subside the transmission? And I think,
yeah, it's possible, not necessarily because of the temperature, but because we're not as near each other, right? This is a virus like flu or many others that moves from one person to the next. The closer we are, the more opportunities there are. So it's possible that, if we're not near each other as much, that could reduce transmission. But it's sort of something that we don't necessarily want to rely on. We really want to be relying on, washing our hands and staying home when we're sick.
Some additional questions about whether we should be doing specific outreach to medically fragile students or staff.
Yeah, I don't think it's ever a bad idea to make sure that if you know there's a particular population or group that might have additional questions or needs, to see if there's anything, that's going on there. I think that's reasonable. Part of this, again, and I know this is a lot, I know this is, evolving quickly, but these same questions are the questions and preparedness that we'd want you to take if we had a bad flu year or, something else going on. And it's never bad to have those points of contact established and have those plans in mind, with the idea that we hope we don't have to use them, but, we'd rather be prepared.
All right, I think we are coming right up at our 2:30 mark. I think we have touched on all of the questions in the chat box. Again, we'll get back to you with some more clarification on those 3 areas I just mentioned. And we really appreciate your time today. We know this was a long webinar. We appreciate all of your questions and your feedback. And so we'll be continuing to talk to you in the coming days. In the meantime, we'd encourage you to reach out to your local health departments and local partners. So thanks for your time. And we appreciate all you're doing to respond to this.